Hi, Dr. Gary Frenette here. And as you recall, you've already seen, I believe, the first chemotherapy video which we would recommend, and that's a general chemotherapy video. In that video, we talk about some of the commonalities that all treatments share and how you can anticipate and react to some of the potential issues you might face. However, as we mentioned, there's about 75 different medicines that we call chemotherapy. And we now wanted to produce a video speaking to you about the specific medications you'll be taking. In this video, we're going to discuss several issues with regard to that treatment. How do those drugs work? How are those treatments administered? What is the schedule of treatments? And we'll go into some of the potential reactions you could have to that treatment and how you can adjust to them. As always, whenever you have any questions, you should call your healthcare team if there's ever an issue. But by watching these videos, you may be better able to anticipate and prepare for some of the rare side effects that can happen. So as you can see here, we're actually within a chemotherapy treatment room. And we have chemotherapy chairs where you can sit and even lie back. There's TVs and internet access so that you can be entertained. And we'll also allow you to have a family member with you or a friend with you during your treatment. The specific number of treatments and the regulations, such as how old they need to be, will be discussed with you with your healthcare team during your chemotherapy teaching session. These videos, for example, are meant to supplement but not to replace that specific interaction you're going to have with us prior to your treatment, so you'll be able to get all your questions answered. During this video, what we'd recommend, as with the first video, is that you write down any questions you might have about your treatment, and then we can discuss those specifically when you come for your appointment to make your appointment more productive and to make sure all your questions have been appropriately addressed. There are some issues that you might imagine come about when you're getting chemotherapy treatment that I'd just like to discuss briefly. And as you can tell, we're in a large chemotherapy treatment room. That's done on purpose so that the nurses can have visual access to you during your treatment. If there are any unfortunate reactions or problems that you're having, we can recognize those immediately. Because it is an open space though, we usually ask that patients refrain from wearing heavy perfumes or colognes. Although you may not be bothered by them, other people may be more sensitive to smells during that treatment and therefore would appreciate you wearing as little perfume or cologne as possible. Likewise, oftentimes patients will bring snacks or food into the chemotherapy treatment room, which is completely reasonable and appropriate. But we'd ask that they not be especially strong smelling because, once again, some people can develop an aversion to strongly smelling food during their treatment. And so as a courtesy to others, we would ask that you try to respect that during your treatment. In addition to the TV, for example, or computers, a lot of times people like to listen to music or other audible entertainment. Because other people may be trying to rest, it's always a nice idea to bring headphones or something like that into your treatment room so you can enjoy the music or the TV at the volume you like without having to worry about disturbing others. The next portion of the video is going to be a slide presentation of your specific chemotherapy treatment. Make sure you have a notepad with you and jot down any notes or questions you might have or that the slide presentation generates so that we can answer them during your in-person visit with us afterwards. This video represents the views of Dr. Gary Frenette and not any clinic or hospital system. It's designed to supplement, but not replace, the written and verbal information provided to you during your teaching sessions. It reviews common trivial side effects as well as rare but life-threatening complications of therapy. Today we're going to talk about the drugs Taxol and Erbitux chemotherapy. To best understand how chemotherapy works in general, we're going to need a brief refresher course on biology. Don't worry, we're going to keep it simple. Remember, all living things are made of cells, And the blueprint for how a cell in our bodies are made is encoded in a molecule called deoxyribonucleic acid, otherwise known as DNA. Here's a brief video showing this process. So cancerous cells are characterized by uncontrolled cell division. Both normal and cancerous cells divide by going through a process called the cell cycle. And the cell cycle goes from a resting phase through active and growing phases, and then to mitosis or cell division. The ability of chemotherapy to kill cancer cells depends on its ability to halt cell division. When the cancer cells are unable to divide, they die. Chemotherapy kills cancer cells more effectively than normal cells, since the cancer cells divide faster and therefore don't have time to repair themselves prior to cell division. I'm going to show now a brief video on the cell cycle process. The scheduling of chemotherapy, therefore, is set based on several issues: the type of cancer, the rate at which the cancer cells divide, and the time at which a given drug is likely to be effective within this cancer cell cycle. And that's why chemotherapy is typically given in cycles. Cycles are simply another name for treatments, which are separated by time intervals. During that time interval, the cancer cells die while the normal cells have time to heal. When the healing of the normal cells is not complete, side effects occur. The normal cells most commonly affected by chemotherapy include blood cells, the lining of the stomach and the colon, and hair follicles. This accounts for common side effects, which include low blood counts, mouth,
nausea, and hair loss. Paclitaxel or Taxol belongs to a group of drugs called plant alkaloids. These are also known as antimicrotubule agents or spindle fiber inhibitors. Spindle fiber inhibitors such as Taxol inhibit the microtubule structures within the cell. Once again, spindle fibers are part of the cell's apparatus for dividing and replicating itself. These spindle fibers help separate duplicated DNA into each dividing cell. Taxol inhibits this activity, thereby killing the dividing cancer cell, and we'll watch the formation of cancer cells and spindle fibers within the next video. Erbitux or cetuximab is technically not a chemotherapy drug, but actually a monoclonal antibody that targets one of the growth receptors, and it's called the epidermal growth factor receptor on the cancer cell. Erbitux keeps the receptors, or the epidermal growth factor receptors, from interacting with each other and promoting cell growth. When the receptors combine, they send a signal to the cell nucleus to divide. Erbitux inhibits that process. The cancer cells dependent on that signal in order to grow. When Erbitux inhibits the activity, the cancer cell dies. Here's a brief video also showing that process. Once again, the epidermal growth factor receptor is on the surface of the cell, as you see here. These proteins or receptors combine, and when they are combined, they send a signal to the cell nucleus to divide, as you see here. Erbitux inhibits the combination of these receptors, and therefore they're unable to send their signal for growth to the cancer cell. Let's talk about the schedule of Taxol and Erbitux. These drugs are given intravenously, together, once a week for 6 weeks. On the 7th week, Erbitux is given alone, and no treatments are given on the 8th week. Anti-nausea medications are given prior to administration of the treatment. Nausea should be, however, quite minimal with this regimen. The entire intravenous treatment is given over 2 to 3 hours for each session. A steroid, such as dexamethasone or Decadron, is given prior to Taxol and Erbitux, along with antihistamines such as Benadryl, and other drugs such as Pepcid. These medications help reduce the risk of a reaction to the drug. The schedule of Taxol or Erbitux is shown here. The drugs are given together once a week for 6 weeks. On the next week, Erbitux is given as a single drug without Taxol, and on the last week, no treatment is given. That cycle is repeated after week 7, and a subsequent cycle of treatment is usually given if the regimen is effective. Infusion reactions or reactions during the treatment can occur with both Taxol and Erbitux. They can include flushing, shortness of breath, palpitations, or lightheadedness. Most reactions are mild, but very rarely they can be serious or life-threatening. For that reason, you'll be closely watched during the initial portion of your treatment. Infusion reactions are reduced with medications that you'll routinely receive, including dexamethasone and other drugs such as antihistamines. Let's now talk about side effects of treatment that occur after the treatment is delivered. Most importantly, remember each person's reaction to chemotherapy is different. Some people have very few side effects, while others may experience more. The side effects described here won't affect everyone who has Taxol and Erbitux chemotherapy. Some of the side effects you may incur are heartburn, for example, and that often feels like, or even nausea. It's important to let us know if you think you're experiencing this, because we can treat that with medications that block acid secretion into the stomach. Constipation or diarrhea can occur. Constipation is the more common reaction and can be treated with medications such as over-the-counter laxatives such as Miralax or changes in diet. Erbitux can cause a skin rash due to the presence of the epidermal growth factor receptor, which it targets, in the skin. It's similar to acne and can be treated with antibiotics just as you did when you had acne as a teenager. Muscle pain or headaches can occur with Taxol. These can usually be treated with pain medications quite effectively over the counter. Rarely they require a stronger medication. Hair loss will occur about 2 to 3 weeks after initiation of the treatment. Loss of hair on the head occurs first, but eyebrows, eyelashes, or even pubic hair can be lost as treatment proceeds. Your hair will grow back at a normal rate after treatment, but may at first have a different color or texture. The cost of your wig may also be covered by insurance. Nail changes can occur with Taxol. There are conflicting data regarding placing fingers in ice during treatment to help alleviate this issue. Maintain good nail hygiene and avoid false nails. Gloves may help nails during work or during sleep. Mouth sores as well as nasal tenderness can occur and can be minimized with mouth rinses or non-alcoholic mouthwashes. Blood counts, especially white cells that help you fight infection, may be reduced with the medication. This occurs 5 to 7 days after the treatment's given. You should report any fever greater than 100.5 or shaking chill to your healthcare team. This regimen actually doesn't usually cause dramatic decreases in blood counts, however. Nausea can occur with this regimen, but really it should be minimal. You'll be given anti-nausea medications before your treatment by vein and by mouth as needed thereafter. And Taxol Erbitux can affect fertility. Talk to your healthcare provider if this is an important issue for you. During chemotherapy, you should practice adequate contraception. Numbness of the hands and feet can occur due to Taxol. This is known as peripheral neuropathy. You may also notice that you have difficulties with fine motor movements such as buttoning shirts or putting in earrings. It's important to report these symptoms to your doctor, as they may be controlled by slightly lowering the dose of the drug. The side effect usually improves slowly a few months after the treatment's finished. Erbitux can also cause loss of electrolytes from the blood, especially magnesium, potassium, or calcium. These can be replaced by mouth or by vein when required. We'll monitor these during your therapy. Once again, nausea is quite mild with this regimen, and you'll receive anti-nausea medications by vein prior to treatment. We'll give you prescriptions for anti-nausea medications to take by mouth in case you have nausea at home. If you experience nausea, take these medications right away and don't simply wait for it to pass. However, since they can cause constipation, you may need a drug such as Miralax or another mild laxative. The medications you may receive include Zofran or ondansetron. You should take one 8 mg tablet every 8 hours as needed for nausea. This medication doesn't cause drowsiness, so it can be a good choice during the day when you want to be alert. Phenergan or promethazine is taken once every 6 hours as needed for nausea. This medication can cause drowsiness variably, and so you should watch for your own reaction to it. Ativan or lorazepam almost always causes sedation, is taken about once every 6 hours, and can be a good choice at night when you're trying to get rest. Now let's go over some of the frequently asked questions with regard to Taxol and Erbitux. First, can I drive to my chemotherapy treatments? Well, we'd like you to have a driver for your first treatment. If you receive drugs such as antihistamines that cause sedation, you may also need a driver even for subsequent treatments. Will I gain weight with steroids such as dexamethasone? Well, these drugs can cause fluid retention and increase appetite in some patients. Be aware of your food intake as well as the quality of the food you're eating. For example, avoid excessive desserts, salt, or simple carbohydrates. Can I get manicures, pedicures, or massage? Well, manicures and pedicures are usually avoided during aggressive chemotherapy. If you're receiving chemotherapy chronically, it may be possible to have manicures or pedicures, but you'll at least want to bring your own tools and avoid cutting cuticles. Avoid skin scrubs if you have skin sensitivity on the palms or soles. Massage therapy, on the other hand, is usually very helpful during treatment, but avoid deep muscle massage if your platelets are low. Remember, platelets are the cells in your blood that help your blood clot. Are there any food restrictions? Avoid uncooked fish, meat, or eggs. There are no restrictions regarding fresh fruit and vegetables. Simply wash them as you normally would before eating them. You may also find that you prefer cooler, lighter foods and meals during treatment. Smoothies with protein supplements can also be a healthy, attractive food choice, as can Greek yogurt. Can I exercise during chemotherapy? Absolutely, and we strongly recommend that you do so in order to maintain your strength and endurance during treatment. You should pace yourself, especially on your slow days, and stop when you become fatigued. Should I change my diet to avoid cancer in the future? We'll discuss dietary changes, but you may find only certain foods appeal to you during treatment or that your sense of taste has changed. Start slowly with any dietary changes and focus on healthy, non-processed foods. That's always a good place to start. Should I take anti-nausea medications at home after my treatment? Well, this can be necessary, and we'll talk about that more during your office visit. Can I take my regular medications? Unless you're informed otherwise, continue your current medications as prescribed by your physicians. Should I take vitamins or supplements? There can be significant interactions between supplements or vitamins and chemotherapy drugs. Please therefore assemble a list of all the vitamins and supplements you're taking. In general, we like to avoid these during your treatment due to unanticipated reactions between the medications. They can usually be resumed safely after therapy is completed. Do I need a port or intravascular access device? Although we can often treat intravenously by simply inserting an IV catheter into the arm, ports can be required with continuous infusions of drugs, when there's poor or limited venous access, or when the drugs are irritating the veins. The video at the end of this summary is going to provide an overview of ports for chemotherapy administration. So in summary, Taxol or Erbitux is effective medicine because there's a therapeutic window. By that, we mean to say that the chemotherapy drugs are specifically designed to be toxic to cancer cells, while your normal cells have the ability to recover from the treatment. Chemotherapy treatment and supportive medications such as anti-nausea drugs and shots to help your immune system are delivered at specific times during each treatment or cycle. The side effects from chemotherapy are generally mild, self-limited, managed with medications or behavioral changes. Severe side effects are very rare. Most importantly, though, if you have any questions or concerns regarding your therapy or the symptoms you're experiencing, please call your healthcare team. It's really what we're here for.
Well, I want to thank you for watching the second video today, and I hope you've written down all your questions so that we can address them during a personal visit with your healthcare team, what we call a chemotherapy teaching session prior to your therapy. That way, I'm very confident that you're going to be comfortable with your treatment and be able to anticipate any issues that arise. As always, however, if something unexpected happens, I want you to feel very free to call us at any time for any reason so that we can address any concerns you might have. My friend and colleague, Dr. Eric Wang, is now going to briefly discuss the use of venous access devices, or portacasts as we sometimes call them, in the use of chemotherapy. Not everyone who receives chemotherapy needs a portacath, but for example, those patients with poor access to veins in their arm, or patients who require continuous infusions of chemotherapy over 1 to 2 days, will be benefited by the use of these ports. With these ports, you can swim, you can shower, and perform other activities as he'll now discuss for you. So move ahead to the next section of the video if you think you may want to learn more about these devices, or if you believe you're a candidate for these.
Welcome. I'm Dr. Eric Wang, interventional radiologist with the Vascular and Interventional Specialists of Charlotte Radiology. Your healthcare provider has ordered a port placement for you. I'm here to review this procedure and to make you and your family members feel at ease. A port is a small device used to obtain safe and reliable access to administer IV medications, such as chemotherapy drugs or antibiotics, and also used to obtain blood samples. Port is a small device, as I mentioned, and is about the width of a quarter and less than half an inch thick. The port is implanted underneath the skin surface at the chest, a few centimeters below the collarbone, and this tubing is then inserted into a neck vein. Most patients are relieved after they have had their port placed that they no longer have to be stuck multiple times in their arms to get IV access. The port, once healed, is relatively unnoticeable and requires very little care. Patients resume their normal daily activities. This can include taking baths, exercise, and even swimming without worrying about the port. During your port placement, you will be taken to an interventional radiology suite, where sophisticated X-ray equipment will be used for safe placement of your port. A technologist will then use special soap to wash the upper chest and neck, and then a sterile drape will be placed over the skin surface in order to provide a sterile environment to decrease the risk of infection. Once you are prepped, the nurse will give you sedation through an IV, and I will give you local numbing medication at the skin access site. A small pocket is created at the upper chest level, and then a catheter is placed under lifetime X-ray guidance into a neck vein. Once the port is placed, the pocket will be closed in a couple layers of absorbable suture, which will heal on its own. You will then go to the nursing recovery area and rest for about an hour prior to going home. Thank you for allowing Charlotte Radiology to be your healthcare provider. Please do not hesitate to ask additional questions during your visit.